everyone should contribute according to his or her means and receive whatever is needed. 65 years later, this French Social Security founding principle still has unanimous support, at least on paper. But with a 20 billion or more euro deficit, the increase in health expenditure could lead it to 15 or 20% of GDP in the year 2050. So national solidarity sees things big time. From a broken pinky finger to insulin for diabetics, everything is included. However, 2/3 of expenses go to chronic and long-term disease. So in fact, Social Security could be easily specialized by concentrating on complex and costly care. Why not take this obvious path and leave acute care to complementary health insurers? Unless we take the problem at its root and try to balance Social Security accounts. There could be a deductible for each person based on income. And under this level, expenses would be up to the individual or his or her complementary insurance. Over that level, Social Security would pick up the rest. What about increasing household costs? There is room to do so, but the subject is explosive. With 9% of household budget for healthcare, France has the lowest percent in the OECD. To make patients more responsible, there is a small amount to be paid on certain costs. But this educational virtue seemed to be long gone. And the splitting up of expenses between Social Security and other insurance creates additional management costs. Not to mention that there are two blind payers who complain to one another about quality of care. One solution would be to open Social Security to competition. The insuree would have one insurer for everything and all advice. The Netherlands moved to this solution in the year 2005. All Dutch people are forced to choose one of 4 private insurers accredited by the government, and they're not allowed to exclude any consumers. Prices must be fair. In France, however, the state refuses to play its true role of impartial referee, and so temporary solutions remain in place forever. The general contribution, a temporary measure to reduce deficit, has been around for 20 years.